The financial and human cost of disease are astounding. Today, 133 million Americans, that's 1/3 of our population, suffer from chronic illnesses. 70% of all deaths are a result of a chronic disease. The U.S. spends $2.8 trillion on healthcare each year, and 85% of those healthcare dollars go to the treatment of chronic diseases. Our aging population accounts for 2/3 of our healthcare spend to treat their multiple chronic illnesses. 68.4% of Medicare beneficiaries have 2 or more chronic care conditions. These patients require more attention and an effective patient-centered care plan with oversight and adherence guidance beyond their typical face-to-face encounter. Research studies have demonstrated time and again that effective care management reduces total cost of care for chronic disease patients while improving their overall health, which is why at the beginning of 2015, Medicare created the Chronic Care Management Program. This program, with its unique 99490 CPT code, reimburses practitioners for providing non-face-to-face time with the patient each month to provide care management to their Medicare patients with 2 or more chronic care conditions. Many of you as providers may already be providing additional care for your patients beyond your standard face-to-face encounters. And now, Medicare is incentivizing providers to do so by reimbursing on average an additional $42 per calendar month per patient that meets the Chronic Care Management Program requirements. According to statistics, some providers could stand to make an additional $300,000 a year in revenue by participating in this program. Unfortunately, few healthcare organizations are staffed to provide the non-face-to-face care, which typically averages about 40 minutes per patient per month, but needs to meet the minimum of 20 minutes of interaction and appropriate documentation in order to bill for this code. Medicare recognizes this challenge, which is why they have allowed care management firms like Care Vitality, a subsidiary of EHR and practice management consultants, to act as an extension of your healthcare organization and provide these services to your patients so you can receive the additional revenue and improve the quality of health in your chronically ill patients. At Care Vitality, we provide a continuum of care for your chronic care management patients by utilizing our clinical care managers, which are all registered nurses, to provide all the services to your patients needed in order for your practice to be reimbursed. Not all care management firms are created equal. We provide the only turnkey comprehensive service offering at a cost that is around $4 to $6 less per patient per month than our competitors. How do we stack up against other care management vendors? There are several key differentiators. Care Vitality, a subsidiary of EHR and practice management consultants, was founded approximately 7 years ago. We have certified and/or trained consultants that have 10 or more years' experience working on over 150 EHR and practice management systems. We have developed a sophisticated tool to identify all of your qualifying chronic care management patients, a service not offered by our competitors. This is a valuable component of participating in this program, so your practice can quickly begin receiving reimbursements and not leave lost revenue on the table. We perform all the patient outreach and engagement to gain patient buy-in and explain the value of the program so you can gain their consent to participate. Again, not a service provided by other care management vendors. We schedule all your patient appointments for your chronic care management patients and ensure they are scheduled for all their maintenance and preventative health screenings and encounters, which, by the way, usually increases the practice's encounter revenue by 20 to 30%. We develop the comprehensive care plan for each patient based on their specific chronic care conditions and make that available for provider approval in the practice's local EHR. Most every other vendor on the market places this burden on the practice. There is no third-party software. Our RN clinical care managers document all the appropriate patient interaction, engagement, and communication in your local EHR. That means your staff and providers don't have to be tasked with learning yet another software application. It is important to document all CCM activities in your local EHR. Third-party software can create safety and security risks for your practice, as well as create a training burden and downtime. Dependent on your patient population, we can provide bilingual clinical care managers to communicate with your patients. We are the lowest cost care management firm in the market by an average of $4 to $6 and have the most comprehensive turnkey service offering, which not only alleviates the burden of trying to accomplish the entire scope of services needed to bill for this program on you, but also frees up time for your staff to stay focused on in-office patient care. We also provide transitional care management as a part of our service offering, so your practice can enjoy the financial benefits of that program as well. At the end of each month, we provide you with an audible report of all your chronic care management patients that the 99490 code can be billed for. We are paid for performance. It is a shared risk-revenue arrangement. We get paid when you get paid. With Care Vitality's service offering, you can improve quality outcomes and patient satisfaction while improving the health of your patients and the wealth of your practice. Contact us today to learn more or to get started. Payments are reimbursed on a rolling 30-day calendar. Don't miss out on this unprecedented revenue opportunity.